Welcome to Module 14 of HIV/AIDS. In this section of the course, we're going to focus on recognizing medical emergencies and understanding when medical emergency services should be activated in a behavioral health or community setting. And although addiction counselors are not emergency medical providers, we may still encounter situations where our clients might experience overdose symptoms or seizures. Maybe they have chest pain, or they may lose consciousness, or have severe emotional distress. And then they could have injuries or other urgent medical concerns. And when emergencies happen, counselors are often among the first people present. And because of that, we have to understand that we need to learn how to recognize warning signs and how to respond calmly and when to call for medical assistance. We also need to learn how to maintain safety while we are staying within the scope of our own practice. And one of the biggest mistakes that we make in emergencies is by panicking and overreacting or minimizing some serious symptoms and delaying getting help. So this module is designed to help you develop a balanced professional response to medical emergencies. The goal is not to turn counselors into paramedics. We're just trying to help you improve awareness and be prepared and communicate and practice safety. So remember to remain calm, think clearly, and those are some really important skills during any emergency situation. So a medical emergency is any situation where a person's health may be in immediate danger and urgent medical attention is needed. Some emergencies develop suddenly and dramatically, while others may appear a little bit more subtle at first. So medical emergencies are going to involve breathing problems, chest pain, seizures, overdose symptoms, loss of consciousness, any severe bleeding or confusion, or if a client has rapidly worsening physical symptoms. In some cases, clients themselves may minimize the symptoms or refuse to acknowledge how serious the situation is. So we need to avoid assuming that someone is just anxious or, oh, they're just intoxicated, or he's just being dramatic, without carefully observing those warning signs. And then at the same time, we don't need to diagnose the exact medical problem. Our role is not to determine precisely what condition is happening. It's to recognize when a situation is appearing unsafe or medically concerning and then respond to that appropriately. So when you're in doubt, seek a medical emergency assistance that's often safer than ignoring the serious problem. So there's several warning signs that we need to look out for where emergency medical services should be contacted immediately. So this is if somebody's having difficulty breathing, if they're having chest pain, if they're losing consciousness, they're having seizures or severe confusion, or an inability to wake someone. If their skin has turned blue or gray in color, or they have severe injuries, or they just suddenly collapse, those are the times when we just immediately call 911 or whatever your local emergency code is. We need to pay attention not only to what the clients are saying, but also any observable behaviors and physical symptoms like slurred speech, slowed breathing, inability to wake them up, if they become extremely agitated or disoriented, or if they have like an inability to respond appropriately. All of these are immediate, serious medical concerns. And some emergencies are going to progress pretty rapidly. So a client who appears just sleepy may become unresponsive in minutes during an overdose situation. So we need to avoid delaying emergency response because of fear of overreacting or fear of embarrassment. It's better to seek that help unnecessarily than to ignore a potentially life-threatening situation. So emergencies can create intense emotional reactions, especially in high-stress environments. And so we may feel fear or adrenaline or panic or confusion or pressure to fix that situation immediately. But panic often interferes with clear thinking and effective responses. So one of the most valuable things that we can do during an emergency is to remain calm and focused. That calm behavior is going to help you to improve your decision making and reduce the chaos. You're also going to be able to communicate and support the communication and reassure everybody else that's present. So speak clearly, move in a step-by-step process through the situation. It's a little bit more helpful than rushing impulsively. Our focus needs to be on the immediate safety of the client and ourselves and everybody else around them. We also need to focus on contacting the appropriate help and remain within the scope of your practice. You don't need to know everything in order to respond effectively. Remaining emotionally steady can significantly improve emergency response situations. When emergency medical services are needed, clear communication is extremely important. So when you call 911, provide the exact location, describe the situation calmly, explain any observable symptoms, and answer the dispatcher's questions clearly. It's important to focus on observable facts rather than guessing medical diagnosis. So, for example, it's more helpful to say the client is unconscious and breathing slowly than I think they're overdosing, unless overdose evidence is clear. Maybe the dispatcher may provide instructions while the help is on the way. So as counselors, we need to follow those instructions without or within our own training and our own comfort level, whatever you feel comfortable with. In some situations, the dispatcher may instruct the caller to remain on the line until the emergency responder arrives. So clear communication is going to significantly improve the emergency response effectiveness. So one challenge that counselors may face is distinguishing between emotional distress and medical emergencies. Panic attacks and anxiety can produce symptoms like rapid breathing, chest tightness, dizziness, sweating, shaking, or feelings of losing control. But serious medical emergencies can sometimes appear similar initially. So we need to avoid automatically assuming that it's just anxiety, especially when the symptoms are severe or unusual or like they're rapidly worsening, or if they are accompanied by some physical warning signs. Like a client with a history of anxiety or substance use disorders, they may still experience legitimate medical emergencies, but when uncertainty exists, seeking medical evaluation is going to be one of the safest options for us. It's not our responsibility to perfectly diagnose the situation. The priority here is safety. So substance use is going to significantly increase the risk of a medical emergency. Like I said, overdoses, dehydration, dangerous withdrawal symptoms, seizures, cardiac complications, or severe intoxication. So we have people who use polysubstance. So polysubstance use is meaning that like they use multiple substances together, and that further increases the risk and it makes the symptoms a little bit more unpredictable. So if somebody were to combine alcohol with opioids or opioids with benzodiazepines, that can cause dangerously slow breathing, and the stimulant is going to increase the risk for the cardiac problems or severe agitation. So we need to remain alert to the physical warning signs rather than just assuming a client's just simply high or they're intoxicated. These emergency situations can become life-threatening pretty quickly when it's substance related. So that's one of the reasons emergency response training and being prepared are really important in the behavioral health setting. During an emergency, we also need to pay attention to environmental safety. Some situations may involve people who are intoxicated or they're emotionally escalating. They have aggressive behavior, or there's hazardous objects around, or just an unsafe surrounding. And we need to place ourselves in a safe environment. So don't put yourself in danger while attempting to help somebody else. Staying safe is going to mean like maintaining awareness of your surroundings. If there's an active shooter, you don't want to just start walking around, Protect other clients if you need to, but avoid interventions outside of your professional training. So don't attempt to, any physically dangerous actions or any advanced medical procedures that you're not trained to perform. Waiting for the trained emergency responders is often the safest and most appropriate decision. Professionalism is going to include recognizing personal limitations and then prioritizing the overall safety. After an emergency situation, documentation is often required. So we need to document any observable behaviors, any symptoms that we noticed, any actions that were taken by ourselves or anyone else, timeframes, emergency contacts made, and the response from the emergency services when it's applicable. Remain objective and factual in your documentation. Don't guess at diagnosis or include dramatic language. So, you can, the more appropriate thing to say, instead of like client almost died from an overdose, you might want to say something like client became unresponsive and emergency services were contacted. So don't put the word overdose in there unless it was confirmed medically. Workplace procedures may also require incident reports or supervisor notification. So the accurate documentation is going to protect both the client and the professional while supporting continuity of care. Medical emergencies can also affect counselors emotionally. So, after an emergency, we may, crumple and we have anxiety and guilt and fear and emotional exhaustion, or we're replaying the event over and over in our head, and the adrenaline responses are normal during stress situations. So you can seek counseling, supervision, consultation, or support when needed after a particularly intense incident. Ignoring those emotional reactions can contribute to burnout or compassion fatigue over time. Self-care is going to include acknowledging those stress reactions and then processing the difficult experience appropriately. We're helping professionals, but we're also human beings. And emergencies can affect us emotionally even when we respond professionally. So as we close this module, remember that counselors don't need to become medical experts in order to respond effectively during emergencies. The most important priorities are recognizing the warning signs, stay calm, contact the appropriate emergency services, and maintain safety, and stay within your scope of practice. Professional, steady responses can significantly improve an emergency situation and help to protect both the client and the staff. So in the next module, we're going to focus specifically on overdose recognition and naloxone awareness, including the common warning signs and the counselor response considerations in behavioral health settings. So when you're ready, proceed to module 15.